In today's episode of the Family Medicine PA podcast, we're going to dive into the topic of human development. I'm your host, Madison, and I work as a physician assistant in a family medicine outpatient clinic. We're going to discuss two developmental theories that can be applied to improve patient care in a clinical setting. The first theory is Erik Erikson's lifespan theory of the 8 stages of man, and the second theory is Jean Piaget's cognitive development theory. Next, we'll compare and contrast the two theories, and here I really want to emphasize the differences we see. In clinical practice, being able to understand each theory's pros and cons can help us think critically about a patient and come up with a very strong diagnosis and treatment plan. Lastly, I'm going to review a case study and provide 2 additional examples which will help our listeners learn how to apply the developmental theories to real patients in a clinical setting. As always, my hope is that this episode helps prepare our PA students to be stronger healthcare providers in family medicine. Let's get started. So Erik Erikson's lifespan theory is the 8 stages of man, and it characterizes development into 8 different stages throughout the lifespan. Erikson was a psychoanalyst who lived throughout the 1900s and published his theory back in 1950 in his book called Childhood and Society. He broke the lifespan into 8 developmental levels, with each level representing a developmental task or crisis. According to Erikson, normal development occurs when an individual can develop a healthy balance of the 2 conditions at hand for each level. Now, it's important to understand that this idea of a crisis between 2 conditions should not be viewed as one desirable and the other undesirable. Rather, Erikson wants us to recognize that both conditions will emerge in each stage. Now, I want to go through each stage of his theory, and we're going to go a little quick in the interest of time, so bear with me. Stage 1 is trust versus mistrust, and this occurs from infancy up into 18 months of age. This is when the infant is completely reliant on his mother and caregiver to feed him, reassure him, cuddle him, and keep him warm. The infant should trust that his mother will be there to meet his physical and emotional needs. Now, recall, as I mentioned earlier, that Erikson did not want us to view one condition as desirable and the other as undesirable. It would be incorrect to assume that mistrust in this stage is a negative thing. Rather, he wants us to think of the ratio of trust to mistrust as a crucial aspect of our social attitude. Consider that every individual needs to develop a level of mistrust because it allows us to anticipate things like danger or being able to recognize discomfort. Stage 2 is autonomy versus shame and doubt, which occurs between 18 months and 3 years. Here, the child will learn what to do with his newfound trust of his mother and the world. The child will use his autonomy to will against others, and that trust might get broken via shame. And I do want to note here that Erikson emphasizes the importance of cultural context with regards to shame, which means that in every culture, there's going to be a different level of shame that comes into play for this stage. Stage 3 is initiative versus guilt, which occurs between 3 to 5 years. As the child begins to envision goals, he should learn to repress any fantasies that developed early on in life. Rather than fantasize, he will learn that one must work for things. Stage 4 is industry versus inferiority, which occurs between ages 5 to 13. Throughout this time, the child will learn to be busy with things such as a puzzle or a project or a work of art. However, attempts towards mastery at these things may fail. Stage 5 is identity versus confusion, which occurs between ages 13 and 21. Here we see a massive identity explosion, but with this comes many identity issues and confusion, especially during puberty. Stage 6 is intimacy versus isolation, which occurs between ages 21 and 39. Here the individual truly learns the ideas of friendship, love, sexual intimacy, and marriage. According to Erikson, intimacy refers to the ability to fuse your identity with someone else's without fear that you will lose something of yourself. Stage 7 is generativity versus stagnation, which occurs between the ages of 40 and 65. Here, the individual is involved with producing something, and just to name a few examples, this could be producing children, ideas, a work of art, anything of that sorts. The final stage, number 8, is integrity versus despair, which occurs from 65 years up until death. Here, the individual is able to understand the wisdom of the ages. In other words, he embodies all stages. To wrap up his theory, I wanted to note that Erikson believed if one developmental stage develops incorrectly, the individual cannot develop to full capacity because each level builds on one another. I want to go ahead and shift our attention to Jean Piaget's cognitive development theory, which was also developed in the 1900s. One thing to note is that his theory does not account for culture, so I think that's something important to consider because from a medical standpoint, we know that culture plays a huge role in development. So his theory focuses on an individual's abilities, and he breaks the stages of development down into four short-lived stages, where in each, the individual masters some major cognitive phenomena. The sensoromotor stage occurs from infancy to 2 years, and here we see the children are beginning to learn more about their environment and how to manipulate their surroundings. Healthy development at this stage looks like the child being able to learn sensation and gain motor skills. The next stage is the pre-operational stage, which occurs from ages 2 to 7. Here, the child is able to use symbols, gestures, and communication to represent their thoughts. We also start to see the child engaging in imaginary and pretend play. And egocentrism is very common at this stage, which is when the child is not able to consider a different person's point of view or perspective. Moving on to the concrete operational stage, this occurs between ages 7 and 11, and this is where the child is able to use logic and reason when solving problems or discussing something. Lastly, the formal operational stage applies to individuals at age 12 years and older. Here, the child can understand more abstract ideas like theories and hypotheses. Now that we've covered the key points of both theories, it's time to compare them. Both Erikson and Piaget's theories are built on discrete stages and milestones which categorize healthy development. Each one identifies challenges the individual must overcome or skills they learn during that stage. Now, one of the more obvious differences between these two theories is that Erikson's theory defines development throughout the lifespan, while Piaget focuses on development from infancy up to early adolescence. The structure of both theories is different as well. Erikson's theory emphasizes this idea that each stage builds on one another. If the conditions at hand develop incorrectly in one stage, for example, too much mistrust and too little trust, the individual cannot progress into further stages without being limited in their capacity to reach full development. On the other hand, Piaget laid out his stages based on abilities. In cognitive development theory, an overlap of two stages may still indicate healthy development. If you have a 1.5-year-old who hasn't mastered object permanence yet, but has already developed the ability to pretend play, which we should note is characteristic of the sensoromotor phase, this wouldn't constitute abnormal development. Rather, there is just an overlap between these two stages. In our final segment of the podcast, I want to start off by reviewing a case study which will help us learn how to apply Erikson's development theory to clinical practice. Before getting into the case study, I want to give credit to researcher Tam Perry and her group for their studies on the day-to-day management of health and disability, along with studies on major life transitions in geriatric patients. Their research looked at geriatric patients facing difficulties with aging and then explained how to apply Erikson's 8 stages of man development theory to come up with successful treatment options. With that being said, let's get started. Our first patient is an 82-year-old male who complains of depression. You learn that his wife died 3 months prior. You also discover that he's been experiencing post-operative pain from a hip replacement from last year, which is causing him significant mobility issues. Now, in the geriatric population, it's very common for patients to experience physical and cognitive changes that limit self-competence. Let's start off by considering Erikson's 8 stages of man theory. Recall that Erikson claimed if one stage of development is not harmonious, this can cause downstream issues for later development. Perry and her team pointed out that issues with mobility can cause geriatric patients to replay earlier developmental tensions, such as those of stage 3, initiative versus guilt. This stage is where the virtue of purpose is developed. Now, looking at our patient, I will first consider how his immobility may be causing him guilt due to inactivity. Recall that Erikson describes the child in this stage as envisioning goals. It's evident our patient struggles to maintain daily activity and goals, and also due to the loss of his wife, he may no longer feel he has a purpose. Now, after we've identified the Eriksonian stage where our patient is facing a crisis, we can more accurately prescribe a therapy for this patient. Based on this apparent stagnation in the initiative versus guilt stage, I would recommend our patient gets involved in a new activity. Now, this could be something like weekly bingo nights or visits with his grandchildren, anything to counteract the sense of guilt from stagnation and immobility. Additionally, this will provide renewed purpose and potential for mastery of a new activity. Now we're going to look at the clinical applications of Piaget's cognitive development theory. One thing that really interested me when I first learned about this was how much research there is based around Piaget's 4 stages of development. Two psychologists I want to mention here are Burbach and Peterson from the University of Missouri, and they looked at several different cognitive development studies relevant to children's concepts of physical illness, which is obviously very relevant to us as family medicine practitioners. Now, what they found was that children's perceptions of illness do tend to evolve in a systematic and predictable sequence that follows Piaget's stages of development. This is a very important discovery because as a family medicine PA, we often educate the parents of our pediatric patients on healthy development. By being able to use Piaget's stages, which are fairly straightforward and simple, we can better help parents with young children. Now, I want to give you all an example of how to apply these ideas. A research study conducted by researchers Newhouser and Amsterdam at the University of California at Davis discovered that children in the pre-operational stage rely on external rather than internal cues to determine illness. However, children in the concrete operational stage rely on internal rather than external cues to recognize illness. Now, let's say you have a mom with a 5-year-old who just started kindergarten and has been getting sick a lot. As the PA, your job is to educate mom on what to expect regarding the illness of her child. You can apply Piaget's theory and the findings of Newhouser and Amsterdam by informing her that due to her child's stage of development, which we know is the preoperational stage, the child will better recognize illness via external cues. Thus, moms should always be on the lookout for signs of illness as well, rather than relying solely on the child's internal cues such as mood and psychological state. Lastly, I wanted to include an example of how we, as family medicine PAs, can apply Erikson's theory to educate parents about their adolescent children's development. Individuals between the age of 13 and 21 are defined by the conditions of identity versus isolation. It's important to communicate to parents that their adolescent child or children will need support when adjusting to a changed body image. We should also explain how it's important for parents to address any fears of social isolation felt by their teens. The overall goal of applying Erikson's theory here is to better understand how we can support individuals based on what stage of life they're in. In today's episode, we discussed Erikson and Piaget's human development theories. We looked at key similarities and many differences between the theories, which will allow us to know when to use one theory over the other in practice. We also looked at how to apply these theories clinically using primary literature from the field. First, the case study following our 82-year-old male showed us how we can apply Erikson's stages of development theory to improve treatment options for psychological distress. We then looked at how Piaget's theory allows us to predict behaviors of children regarding illness, which also allows us to better educate parents in the clinic. Lastly, we discussed how a family medicine PA can educate parents on how to better support their teens based on Erikson's 8 stages of man theory. Before we go, I just want to encourage all of our listeners to continue studying these topics. There's so much more to learn about Erikson and PH theories and how to apply them to your role as a family medicine PA. Thanks for listening.